Mike, hi. We can hear you though. Right.
Beautiful. Welcome. We'll give people some time to join the session, and then I will give some notes and make some initial announcements, and then we can go ahead and get started. At the end, I just ask that whoever wraps up hands it right back off to me. I'll go ahead and make those final remarks. I think the way that we've set this up is that Q&As are going to be managed by the non-speaker. Let me know if you have any questions, and I'm here to support.
Wonderful. We good to go ahead and get started?
Let's give it just a few moments for people to join. We don't currently have anybody in our session, so we'll give them just a few moments to hop in here, and we'll start just right after the 45-minute mark.
If you see the countdown clock, it's counting down. No one can hear you until it gets to 0, and then Drew's going to make some announcements.
Understood. Thank you.
Thank you so much, Mary. Okay, so as people are joining, I'll go ahead and make some announcements as everyone logs in. So first, we are recording the session, and it will be available here in Excel events for the next 30 days, and on the Alliance's YouTube channel after that. Secondly, if you'd like to ask a question during the session, please make sure to use the chat or the Q&A area to the right of the viewing window. If you'd like access to English or Spanish captions or Spanish audio translations, please use the widget below and then open them in a separate browser. Finally, this webinar is a breakout session. The speakers will not be able to see you, but they will be able to see your chat and Q&A comments in the panel to the right. So please feel free to use those throughout the session. And then I'm going to go ahead and send a message here for you, and you'll be able to click that link for those English to Spanish translations. All right, looks like we are just about to get started. So I'm going to go ahead and hand it over to the speakers to begin.
Wonderful. Thanks everyone for being part of the session today. Really excited to be part of the Hunger Free Communities gathering this afternoon. My name is Daniel Riff, and I am with DoorDash. I lead the government and nonprofit operations at DoorDash, and I'm really excited to be doing this session alongside partners that we've worked with over the last couple years on home delivery, and tell the story of how delivery has played a role in strengthening a produce prescription program. So thank you again for being with us. Please feel free to include any questions in the chat here, and we will get to those as we go. So I would love to introduce the other folks that we have to speak to you today. Mike, do you want to introduce yourself? Yes.
Hi, everyone. Yeah, thank you. I'm Allison Marshall. I'm an assistant professor at Georgetown University. I have a background in social work and public health, and my work on this project was done during some of my postdoc work at UT Health, which we will also talk more about as we get into the presentation.
So we're going to talk about how we all work together to strengthen a produce prescription program that Brighter Bites was leading, and sort of each of our roles in that effort. I'll also spend some time at the end talking about how DoorDash partners with all types of nonprofits on home delivery across the country, and happy to answer any questions on that as well. But I will hand it over to Mike. Mike, I can start by playing this video. I'm not sure if we'll get audio on this, but we will try it. And if we don't get audio, we can move to the next one.
Hello, my name is Sampana Su. I'm a research coordinator and I'm part of Brighter Bites. At Brighter Bites, we believe that every child should have access to nutritious foods. Brighter Bites is a nonprofit that delivers fruits and vegetables directly into families' hands. We teach families how to use the produce and watch their behavior change. It's free, and we make it happen through a simple three-part formula: produce distribution, nutrition education, and fun food experience. Since 2012, Brighter Bites has provided over 65 million pounds of produce and millions of nutrition education materials to more than 1 million individuals, including teachers, in 12 cities across the country. Partnering with DoorDash's Project Dash is crucial to reaching members of our community who are unable to make it to our produce distributions due to challenges like long working hours, transportation issues, or unpredictable schedules. The Project Dash deliveries provide families with access to fresh produce and nutrition education directly to families' doorsteps, supporting long-term health. Many parents have shared that they have no way to pick up their produce, so having the option for delivery straight to their door has been incredibly helpful. We're proud of the work we accomplish each day to serve the Houston community and look forward to delivering many more fresh produce bags with Project Dash.
Awesome. All right, Mike, over to you.
Thank you, Daniel. So I wanted to talk first just about what the Brighter Bites school-based program is, which is where this Produce RX program all was born out of. So it was the Brighter Bites school-based program. It has three main components. First is produce distribution that you see here. We provide families that participating schools with 50 servings of fresh produce every other week throughout the school year. Then the next component is nutrition education, both for parents and kiddos. We implement the CATCH curriculum in the classroom and send home bilingual materials for parents and the whole family to understand why it's important to eat healthy and do it in a fun way. And lastly, we have what we call our fun food experience. We want everyone to feel like healthy eating is something fun. So we go to the schools and host in-person culinary demonstrations. We host video and streaming cooking classes for our families, and we try to encourage our families to have fun with their kids in the kitchen at home to really make these habits stick. Next slide, please. So our goal is to bring fresh produce where kids already are, and that is why we choose to work with low-income schools. We work with Title I schools with free and reduced eligibility of 80% or above. But if you can click twice, we have a little bit of text here. Really, the reason we're doing this is that research shows that children are not eating the recommended amounts of fruits and vegetables, and they're regularly consuming high amounts of sugar-sweetened beverages. Brighter Bites provides a solution in bringing this fresh produce to school on a biweekly basis, making fruits and vegetables accessible and free for families. We have teachers and parents telling us that their kids are not asking for those Takis or those sugar-sweetened beverages anymore because they have fruits and veggies from Brighter Bites that they're eating. And so it's really exciting to see that we're helping them change their habits through providing this regular access along with the education. Next slide, please. And you can bring up the text. Thank you. Another problem shows that children are just not receiving the sufficient amount of nutrition education hours needed to affect their behavior change. It's really been devalued in the public education sphere in favor of hard sciences and more skills that are tested and things like that. And so it's really difficult for children to even learn the basics of why it's more important or why it's healthier to eat fruits and vegetables than it is to eat candy. And so Brighter Bites works with schools to help them find the time in their schedule and show them easy ways to get this education into their regular schedule and help these kids understand the importance of eating healthy. You'll see in the middle there, we also engage local athletes. Those are some football players from the University of Maryland that came to one of our Maryland schools. We try to do what we can to show both teachers and kids that healthy eating is fun and for everyone. Next slide. And this is our fun food experience. So we know that the studies show that kids are consuming more empty calories from added sugars and solid fats, affecting their overall quality of diets. And we try to show them that they can eat yummy things that are healthy and that are going to add nutritious calories to their diet. We have a whole library of nutritious recipes that are free and available online at brighterbites.org. They're all available in bilingual format, and they've all been kid tested and approved. And so they're really ways that you can help your family eat healthy fruits and vegetables in new and different ways that your kids might love. Next slide. So we're doing this across the country. We have programming in Texas, where I'm from. I'm in Houston, which is where we started. But we also work in New York, Philadelphia, DC, Southwest Florida, into New Mexico, Arizona, and California. Most recently, we launched a program in San Diego as well that's not on this map. In all of these locations, we work with elementary schools, early childhood centers, and summer camps to send homeless produce on a regular basis and provide the nutrition education. I'd be remiss after a lot of what we've heard today, like I know that there's a lot of discussions about the impact of the big, beautiful bill, and Brighter Bites definitely was impacted by that. A lot of this expansion was made possible through SNAP-Ed funds. And many of you know that was completely eliminated by the reconciliation bill. So this map may look differently next year. We've really had to make some tough decisions about where to spend the rest of our dollars. Luckily, we have a diverse portfolio enabling us to continue our mission. Next slide. So this is just kind of overview of the main steps that we take to implement Brighter Bites in a community. We first, of course, we have to engage the schools themselves, or the YMCAs, or whoever we're working with, and make sure that the leadership there is engaged and interested and going to be committed to helping their families complete this program, because it really does take a lot from the partner organizations. As you can see in this second picture here, we do a lot of on-site bagging, where we're bringing bulk fruits and vegetables into the gym or the auditorium, and using parent volunteers to help us pack the individual bags. So it really takes a lot of pre-planning with school partners and making sure we can get all of this done. We also need a produce partner to be able to donate the produce or transport it for us. We frequently work with food banks. These pictures are all showing produce that was sourced by the Houston Food Bank, which is the largest food bank in the country and one of our biggest partners. And they manage the donations of produce from farmers, from grocers, and we select from that to send a variety to our schools that will be enough to feed all of the enrolled families at the school. And like I mentioned, it shows up at the school, and we work with our parent volunteers to get it all into sets of bags where every family gets 1 pineapple and 2 chayote and 3 mangoes, or whatever we happen to have that day. Next slide. And then, of course, the nutrition education is a very important component. And so we're teaching that in the classroom. We try to align it with our Brighter Bites distribution day if possible. But we also have exciting, fun nutrition activities for kids when they come to pick up their produce. And we have frequently a fun food experience for them, that we're a tasty recipe that's using some of the produce that's going home in the bags that week. We want families to take home the fun, to feel this excitement at the distribution in the school around eating healthy, and then bring it to their own kitchen table and have this exciting transformation in their own lives of learning why it's important to eat healthy. And I think what's really important and special about Brighter Bites is that we're replicating this regularly with the community. This is not just a once a month. It's not just open to the community and anybody could come. We're targeting specific families, inviting them to come back, and we're going twice a month for the entire school year. So we go 16 times to each of our schools. And this helps families build those habits over time to really improve their nutritional behavior. Next slide. And so this school-based program has really shown a lot of real potential to change dietary behaviors. We decided to pursue opportunities to get this intervention to the children who need it most, those who are identified by their pediatrician of being at risk for chronic diet-related disease. In the fall of 2022, we partnered with the University of Texas School of Public Health, UT Physicians Pediatric Clinics, DoorDash, and Speak Retail to launch our first Produce RX pilot. I believe I'm going to turn it over to Allison, who's going to describe that for us.
Thanks, Mike. So Brighter Bites is and has always been data-driven. We've demonstrated, we have all this great programming and those great photos that Mike showed you, and we've demonstrated that it's effective, right? So we've shown in a longitudinal study that 2 years post Brighter Bites intervention, so having no program for 2 years, we saw sustained improvements in child fruit, vegetable, and fiber intake, sustained decreases in child total fat percent and daily calories from sugary beverages, and sustained improvements in parental fruit intake and fruit and vegetable combined intake, as well as home nutrition environment improvements. We also did a plate waste study and showed that Brighter Bites participants had less fruit and vegetable waste per item and by meal, and less nutrient loss, which, as we know, is important both for child health, right? And also thinking about being a good steward of the funds that we have. Some of these kids are relying on their school meals for a bulk of their caloric intake. So really maximizing that nutrient intake as well is really critical. And we also showed among Brighter Bites participants decreased food insecurity. Next slide, please. So building on that data foundation that we have and what we know about Brighter Bites participants, we know that our Brighter Bites participants experience high rates of food insecurity. They experience barriers to accessing healthy foods. They have, among some of them, high rates of overweight and obesity. And while produce prescription programs are gaining in popularity even more now than they were in 2022 when we first were putting this together, there persist gaps in the literature, right? So there's a lack of data on implementation and logistics, a lack of randomized controlled trials testing produce prescription programs, lack of longitudinal data, a focus on pediatric populations, and not a lot of studies measured at the same time food security, nutrition security, health behaviors, and health outcomes. So we saw a lot of single group study designs or maybe programs that focused on only one of these aspects. So to address this gap in the literature, we worked closely, we leveraged existing and built new partnerships, including the community organization Brighter Bites, healthcare and academic partners, that's the UT Health School of Public Health, and the clinical partner, which we'll get into, but that's the pediatric clinics through UT Health, and our delivery partner, DoorDash. Next slide, please. Our study had 3 arms. So we had one group of families that got DoorDash produce delivery. So DoorDash delivery drivers bring Brighter Bites produce to families' homes. One group received produce vouchers, so $25 to purchase fresh produce at several of these designated retailers. And then we had a third group of waitlist control. So this was our comparison to look at sort of their regular standard lifestyle. And then at the end of our trial, then they received the intervention. Next slide, please. This is our schematic for our recruitment. So I mentioned the pediatric clinics. So we had 2 pediatric clinics, and we were recruiting patients who were ages 5 to 12 years old with a BMI that put them in overweight or obese. They were randomized at that point to one of 3 delivery groups, right? So that Brighter Bites, DoorDash delivery, the produce vouchers, or the waitlist control group. Each group gets 32 weeks of programming, which took roughly 8 to 9 months. Next slide, please. So this is all possible through this partnership with UT Health and UT Physicians, the School of Public Health, and Brighter Bites. So We worked with UT physicians. They helped identify eligible patients, recruit patients, obtain the primary outcomes. So at recruitment, our participants had blood work done, so hemoglobin A1C, lipid panels, and we also repeated those measures at the end of our study. So that's part of what makes our produce prescription randomized controlled trial stand out. We also worked with the physicians to schedule those follow-up and well check appointments. School of Public Health, Center for Health Equity worked to facilitate this collaboration between UT physicians and Brighter Bites. Really worked in the study development and design, developing those processes and recruitment workflow, developing those assessment tools and managing the data. And Brighter Bites, our partner, facilitated the produce and voucher delivery, scheduling, all of those logistics, tracking and following up with participants, delivering that nutrition education, and also really building on those community relationships that are built with Brighter Bites. Next slide, please. So diving in a little bit deeper into what the actual program consists of, we have those produce boxes that are delivered. So this delivery strategy is intended to reduce barriers to access to fruits and vegetables, like transportation or time barriers. So folks maybe can't get off work, or they don't have transportation to get to the grocery store. An alternative approach is this fresh produce voucher, which is a plastic physical gift card worth $25 for fresh produce that was reloaded every 2 weeks. And it was available for use at 6 retailers through Speak Retail, our partner vendor that worked with us on that. This is designed to address other barriers to accessing fruits and vegetables, right? So some folks really wanted to be able to pick their own fruits and vegetables. Something that we've heard a lot is families don't want to waste fruits and vegetables, so they really want to get the fruits and vegetables that they know that their family and their kids will eat. Of course, this does come with some challenges. Maybe these retailers aren't convenient for folks. They still need the transportation. So the comparative effectiveness randomized controlled trial we're doing is to compare these 2 different strategies of produce delivery and how they can impact dietary behaviors and the health outcomes. Both of these groups also received nutrition education via a printed handbook and the Brighter Bites app, which Mike mentioned. The website, all of it's available in both Spanish and English. These are some screenshots here from the app, but you'll see, and the app is available for free, and you don't have to be a parent or a participant in Brighter Bites to access it. But it's a treasure trove of resources. You can search recipes by meal type, by a specific ingredient that you want to use, and there's an emphasis on culturally relevant and low-cost ingredients, and it even shows you the cost to prepare each recipe. So we're really trying to make the nutrition education accessible for families. Next slide, please. So some of the strategies, or some of the things that inform these strategies, we're thinking about the barriers that I mentioned, looking at equity. So for the typical Brighter Bites model, folks come and pick up their fruits and vegetables at school. Some families, their kids ride on the bus, so adults maybe don't get to come pick them up. So this produce box home delivery is a strategy to improve equity for our families. And while families don't get to pick their own fruits and vegetables, the fact that they're getting something that they didn't have to pay for gives them a low risk opportunity to maybe try something new and expose their families to a greater variety of fruits and vegetables. Considerations for the produce voucher that we were comparing to, we used the plastic physical gift card, the idea behind that being reduced stigma, which is still something that comes up for families. Families are able to use that however they want to prior to expiration on fresh produce. So we had the funds roll over to the end of the program, but it was restricted to those specific stores. And again, it requires time and transportation access. Next slide, please. So our sample for the randomized control trial, our average child age was 9 years old at enrollment. 45% identified as Black or African American, and almost 48% identified as Hispanic or Latino. In line with our Brighter Bites statistics, we saw 61.5% reporting food insecurity, 25.7% reporting nutrition insecurity, and 62.4% reported participating in 2 or more nutritional assistance programs. And at baseline, the mean total fruit and vegetable intake was about 2 cups per day. We did see that the BMI was overweight or obese, which was part of the inclusion criteria, and we didn't see any differences on other clinical health indicators by group. So one thing I want to note about that is the 2 or more nutrition assistance programs per day. Families are taking advantage, they're using the programs available to them, and they're still experiencing food insecurity. So this is, as we all know, a big need. Next slide, please. So here we highlight the data, the numbers, right? That the large proportion of our families that were participating in 2 or more nutrition assistance programs and the high rates of food insecurity. And you also might notice on the top row, the employment status, right? So these families are working hard, they're trying to get food on the table, and they're still experiencing food insecurity at baseline. Next slide, please. So we had good program completion. We did lose a few families to follow-up, but that's not uncommon. Families move for all kinds of reasons, but most families that began the program stayed in the program and received all of their programming materials. Next slide, please. So an overview where we are now. So we started the recruitment in October 2022. We enrolled 150 families, 150 children. 155 families were eligible. So while we had a 14.7% enrollment rate from the number of families that we screened, almost everyone that was actually eligible to participate did choose to enroll. So we got very positive responses there. Our programming was on a rolling start so that as close in time to when families were eligible and enrolled, we wanted to get them started in the programming. To address those gaps in literature that we identified previously, we have published a design and protocol paper. We've been presenting nationally and internationally, and our main outcomes paper actually just was accepted earlier this week, which we're of course thrilled about. Next slide, please. So here we want to highlight some of those DoorDash impacts. The families who got the DoorDash produce had higher levels of compliance because they didn't have to go anywhere to receive their dose of programming, right? And they also reported consuming the majority of their produce deliveries. Families who received vouchers ultimately purchased and consumed less produce than families in the DoorDash arm. On average, they left about $66 on the cards, which we hate to see, right? Because you want to get food on people's tables. Next slide, please. In our DoorDash group, we saw more than 70% of survey respondents said they consumed all the fruits in the delivery, and more than 55% said they consumed all the vegetables. 80% consumed all or half the fruits and vegetables combined, and 71% reported that DoorDash delivery was helpful in influencing family fruit and vegetable intake. Next slide. So here we have some quotes, some feedbacks from our families. One participant said, "I think everything really helped. He enjoyed everything," talking about their child. "There was a lot of fruit and vegetables and fruits. Well, one change was that I was able to use more of the vegetables and introduce it to him because he didn't really enjoy vegetables. And well, I saw many new recipes and tried them for him. The deliveries were very convenient. And it was exciting for the children to see the package arrive, and they were initially interested in what was inside." So we're seeing the impact of having that access to fruits and vegetables at home. We're hearing, they're trying new fruits and vegetables because they were provided for them, and really trying to change that that culture and the way that people are feeling, have energy and positive reactions around getting their fruits and vegetables. Next slide, please. So ultimately, this work has been so rewarding and a lot of fun, and I just want to highlight on the study side the efforts of UT Health Houston and UT Physicians, the UT Health School of Public Health Center for Health Equity, and Brighter Bites. And with that, I will hand it to our DoorDash partner, which we also couldn't do it without. Thank you.
Thank you, Allison, and thank you, Mike, for sharing the research that you've done. Allison, exciting to hear about the progress on the study as well. I wanted to share a little bit about Project Dash, how we partner with nonprofit organizations all over the country that use our platform for delivery for their programs, just like you heard about Brighter Bites using DoorDash for their program, for their produce prescription program. At DoorDash, we believe that home delivery is essential for government programs, nonprofit organizations, social impact distribution efforts to succeed. You probably know that we work with restaurants, we work with grocers, we work with pharmacies, but we also work with nonprofits because we understand that home delivery is really important for their initiatives to succeed as well. And when we work with those organizations, we see, as you saw in this presentation, increased equitable access to food and resources, reduced stigma, and also for programs that currently have home delivery initiatives, this often helps relieve pressure on staff or volunteers to cover all of the deliveries. The team here at DoorDash, we work with so many organizations around the country. In any given month, there are deliveries from more than 1,000 locations across the U.S. These might be schools, these might be food banks, these might be houses of worship where DoorDash drivers are coming and picking up food. And through Project Dash, we've done more than 8 million deliveries with our partners, which amounts to more than 135 million meals delivered. We have partners basically anywhere and everywhere. This is really a fraction of our partners across the country. We work with a lot of food banks. We work with a lot of food pantries, Meals on Wheels organizations, United Ways, children's nutrition programs like Brighter Bites, and it works in all types of areas of the U.S. And one more thing I'll mention is that a lot of our partnerships are actually in pretty rural communities where transportation can be a really massive barrier. About 15 to 20% of Project Dash deliveries are in rural areas. So it is not just an urban solution. The produce prescription partnerships, some of them look similar to what you heard today. We also have produce prescription efforts that are funded through sources like GusNet, through USDA, which provides produce prescription funding. Brighter Bites is also a partner of ours for their GusNet program, and we have those partnerships around the country. There are also many states that allow for Medicaid reimbursement of food delivery for healthy food. And we do a lot of delivery for those programs as well in New York, California, Massachusetts, to name a few, where we have those partnerships. And we're also part of the National Produce Prescription Collaborative, which is a great organization that is really active in the space. Through DoorDash, we can deliver pretty much anything. You heard about the produce boxes that we help deliver for Brighter Bites. That's pretty common. We also help deliver prepared meals, USDA commodity boxes, especially for the Senior Food Box program. It doesn't even need to be food. We have partners that use us for things like diapers or food rescue. And we deliver within a 15-mile radius of any pickup point. So we really specialize in that local delivery. And our partners can set up as many pickup points as they want. So we have partners that might serve, a 20-county service area. So they'll set up different distribution points around that area. And sometimes those can even be trucks. So it does not even need to be a fixed location. You could drive a truck out and park it in a lot, and that becomes where the Dashers come to pick up. Our delivery process is pretty simple. Our partners, in this case, Brighter Bites, they're the ones that are determining who is getting delivery, what they're getting, when they're getting it. DoorDash is not doing any of that, and we are also not providing the food for these deliveries. We are just acting as the delivery partner. So whenever our partners are ready, they have access to their own page in the DoorDash portal where they can upload those deliveries, and they can do that with as little as 1 hour's notice, and Dashers will come to pick them up and take them wherever you would like. It's our system that does all the automated routing, and the drivers are usually picking up for up to 10 households at a time. So we try to make it pretty efficient, and we often hear that Dashers like these deliveries, not just because they're helping out in their community, but also because they're able to get so many at once, and then they're busy for a good amount of time finishing their route. This is just a quick preview of what our partners have access to. So this is our online portal. Everyone on your team can see where the drivers are. You can monitor the deliveries. You can see the data once they're completed. It's a very user-friendly process. And the only cases where we communicate directly with the participants is they get text updates, just as you would if you placed an order on DoorDash. But otherwise, they don't need to use our app. There's nothing having to do with our app for this process. And the Dashers get these deliveries as offers in their app. And they get all the information. They see where they'll need to go, how many deliveries. They also see the pay before they choose whether or not to accept the order. And then in terms of pricing, our partners pay a flat rate. We also have discounted rates for nonprofit partners. And we start that around $5 per delivery. So we try to make it pretty reasonable. We do not profit on our nonprofit partnerships, nor do we seek to. And there's no payment from the program participants, no other fees. It's just you pay as you go, depending on however many deliveries you need to use us for. And if it's a seasonal program, let's say, it's just a summer program, totally fine. I'll also mention that this month, in response to the SNAP crisis and the shutdown, we have waived all fees for Project Dash partners. So we are not charging for delivery this month. And that also applies to new partners. So if you are part of an organization and this sounds like something that could really be valuable, we are doing expedited onboarding as well. If you are looking to take advantage of the free deliveries happening this month. And this is our team's email, projectdash@doordash.com. We're always happy to answer any questions and if check what DoorDash looks like in your area if you're interested. And I'll just close by saying Brighter Bites is a really great partner of ours. We work with them on several programs, and I think they have done a really great job of understanding the power of home delivery and applying it wherever they can apply it to strengthen their programs. That is really our hope, is that our partners are the ones that get the home delivery superpower, figure out where it fits in. We often learn from our partners about where this might make sense. We didn't, produce prescriptions were not on our radar a few years ago, but now we have a lot of partners using us that way. We have partners that use us for disaster response. It really is designed to be really flexible. So thank you everyone for your time, and feel free to drop some questions in the chat.
Daniel, could you go back to the project schematic? I fear that I glanced over some of the clinical health indicators, and I'd like to just sort of reiterate some of that, if I may, please.
Yeah.
Thank you. Yeah, so I felt like I didn't spend enough time talking about what really makes this comparative effectiveness randomized control trial stand out, which is, we have the control group, but also incorporating those the blood work, those clinical health indicators at baseline and post program is a key part of addressing that gap in the literature that we identified. And something that I wanted to note about that is that we were able to do that blood work at no additional cost to the clinics or to the patients, because this was already standard of care for patients with a BMI that's overweight or obese. So one thing that I think is important to note is that we're folding in what's already going on in the clinic and using it to strengthen the study design, and working with our clinic and community partners, which is only possible because we had that strong clinic buy-in and involvement in developing and implementation. Thanks so much.
Thanks, Alvin.
And yeah, and we did have that question in the chat. Jill asked about feedback from participants indicating why so much money was left on the cards. So I mentioned, Brighter Bites did a lot of outreach to help remind participants about it. I know, Mike, you mentioned that some participants would forget to bring the card with them. We did outreach to remind them, let them know when it was being reloaded. Sometimes participants lost the card, so they had the ability to get a new card sent to them, and that support was available in both Spanish and English. And some families did use all of the funds, or almost all of it, leaving just pennies on there, right? Mike, do you have anything else you'd like to add to that?
No, just that I think really the take home of this slide and that experience for us is that the model of sending actual fruits and vegetables really has some value to it. It helps overcome that barrier of having to get to the grocery store. It also, some people hesitate around the idea of product choice. Like, families should be able to choose the vegetables and fruits they want to. Of course, we all want to. When we go to the grocery store, we see Brighter Bites as more of kind of like a co-op experience where we're just getting whatever's in season and learning how to use what's in season. And that really pushes families to learn how to use new and different kinds of fruits and vegetables that they otherwise would not purchase in the grocery store. So yeah, for these and many reasons, we believe that the delivery of actual produce is going to be more effective, and you'll see higher levels of compliance with the prescription.
And I'll just add, it takes away some of the mental labor, right? Deciding what you're going to get at the grocery store and things like that. Well, you just have these things now, and now you get to sort of work with your family and the app and resources and figure out what to do with them, which can be a lot of fun.
Amazing. Well, thank you guys so much. I just want to thank all of our speakers. Up next, we do have a 15-minute break to check so that you can check out the on-demand content or visit our sponsors' exhibitor booths. If there are any other final remarks or things that you guys want to say, is there anything else that you'd like to talk about? All right, awesome. Well, we will see you back at 3:45 Eastern for your choice of one of 3 sessions. To join one of these 3 sessions, click Agenda in your navigation bar to the left of your screen, and be sure to click the right arrow and scroll through all of the available sessions. That concludes our time together today. Again, thank you so much to our amazing speakers, and have a wonderful rest of your day.
Thanks, everyone.
Thank you.